breaking news on WFLA Now. Here's JB Buno.
We are following breaking news out of Sarasota, where the Manatee County man in his 60s who tested positive for coronavirus has been discharged from the hospital. This is news coming from Doctors Hospital of Sarasota, where they have announced the first hospitalized patient in Florida with COVID-19 has officially been discharged. Hey there, everybody. JB Buno here with you live on WFLA Now to make sure that everyone knows about this latest news here out of Sarasota County. The Doctors Hospital of Sarasota announcing that that man in his 60s, the Manatee County man in his 60s who tested positive with COVID-19, that test was then later affirmed by the CDC, has been discharged by the hospital there in Sarasota. I'm going to read this here for you. To put patient and caregiver safety first, the hospital closed the operating rooms for elective procedures for 3 days and returned to full operations on March 4th. Additionally, per CDC guidelines, certain employees were furloughed with full pay for scheduled shifts. Doctors Hospital Sarasota ERs in Sarasota and Lakewood Ranch are operational. We have reduced the number of entry points in the hospital to allow for screening for all patients, visitors, colleagues, and caregivers. We are following all recommended cleaning standards to protect our caregivers and patients. Respiratory conditions are common this time of year in our community, so we continue to treat and admit patients with these conditions. We are following infection prevention protocols and CDC COVID-19 guidelines. We continue to work closely with the Department of Health and the CDC to ensure we are taking appropriate precautions for our patients, caregivers, and the community. This is from Monica Yadev, Director of Marketing and Public Relations for Doctors Hospital of Sarasota. So again here, everybody, following this breaking news that the Florida patient with COVID-19 in Manatee County, a man described in his 60s, we do not know the identity of that man, man in his 60s who we didn't know in the governor's press conference, Governor DeSantis' press conference, we weren't exactly sure. We were told that they weren't exactly sure how this man contracted COVID-19, that there was still some question marks there. That man, again, in his 60s, who was said to have some other underlying additional health complications, that is the man that has been discharged from the hospital. Now, there are many questions here in regards to this. What does this mean? What kind of isolation will the person be under? What kind of restrictions will the person have from returning to everyday life? These are questions that, because this is breaking news, this announcement coming down about 10 to 15 minutes ago, there are so many questions that we don't know the answers to. I mean, is this person going to be in a strict isolation type of environment? Is the person going to be allowed to travel? Is the person strictly going home to continue the recovery process? And will the CDC be involved in that recovery process in any way and making sure that that this person isn't interacting with the public at large as far as and spreading COVID-19? So that there's a lot of questions. In fact, so many questions that in the next couple of minutes, it is very possible, I'm not saying likely, but it is possible that we could be getting a follow-up email from either the governor's office, from the State Department of Health, from the CDC in regards to this specific patient about where we go from here. Because this news is so fresh and because we're reacting to this news right now on WFLA Now, there's just so many questions that are unanswered. But for folks in the Manatee County, Sarasota County area, this is news that is definitely one that you want to pay attention to, because a person who, again, tested positive for COVID-19, the presumptive positive test that was first and then later verified in the follow-up test by the CDC, that person has now been discharged from the hospital. You don't know exactly what happens next, and it's something of note, I'm sure, for folks in Sarasota and in Manatee County. Again, it's a Manatee County man in his 60s, and it is he's a Manatee County resident who was at Doctors Hospital of Sarasota. So a lot of questions to be answered. We don't necessarily believe for any reason that this person is going to be visiting, very public areas, and that there's any reason right now to worry. That we're just sharing the news, of course, that this person has been discharged from the hospital, has been sent home from the hospital. And again, reading here the release from Doctors Hospital of Sarasota, they had to take very specific and specific preventive measures to ensure that this wasn't that COVID-19 wasn't going to spread to any hospital personnel, any patients there that were at Doctors Hospital of Sarasota. So all of these things that had to take place, preventive measures that are now off of the really, so to speak, that are not really of concern anymore to Doctors Hospital of Sarasota, other than the fact that now they have to continue to make sure that everything there is clean, everything there is disinfected, and keeping the hospital safe. But for folks who work in hospitals, you know that this isn't anything different than standard procedures. You're always making sure that hospitals are as clean as possible to prevent people from going to that hospital and risk being around something that could be shared, as far as whether it's the flu or coronavirus. So a lot here to dissect, a lot here to kind of break down. I'm going to kind of get to some of the Facebook Live comment sections here. But of course, as many of you are pointing out in the Facebook Live comment section, this is good. This is good news for that patient. If the patient is being sent home, then of course they don't say in the release. They don't say in the release. And the release is, we're going to put all of it on WFLA.com. But you would imagine and you would hope that the patient is doing much, much better. I don't know if they are allowed to say the condition, but I don't know if they're allowed to talk about whether or not the patient is improving. They don't say in the release whether or not the patient is improving. So I can't sit here and say that this was done because that the patient was discharged because the patient was discharged because the patient is improving drastically. We can't say that because they don't say that in the release. It's very possible perhaps that they discharged the patient because it was deemed better for the patient to be in an area other than a hospital where they're obviously dealing with a lot of incoming patients, and for isolation reasons, it's better for that person to be discharged from the hospital. We don't exactly know at this time. So for people there are people in the comment section that are saying, "Oh, it's so glad that I'm so glad to hear that the person is getting better." You can't just assume that the person is getting better unless we're explicitly told that the person is getting better. So remember that. And I'm looking here. Yes, many of you mentioning HIPAA laws. So remember here that there's, just because the patient is being discharged doesn't mean that the patient is improving. It just means that the patient is being discharged. And all we have is the information that's been given to us by the hospital at this time. I'm sure we're going to hear more from Florida state officials, whether that's in the State Department of Health or whether that's in the governor's office. But as of right now, that's the news, everybody. It's just the news that the person has been discharged. I'll try to get to some comments here. Janine AB in the comment section, hashtag HeyJB, and I will be looking for hashtag. We've been doing this all week. I will be looking for hashtag HeyJB comments here and trying to answer your questions. In fact, I'll put it here in the comment section that we'll be doing here. We'll just do a quick live Q&A, you guys. You should see it there in the Facebook Live comment section, but it was Janine AB, hashtag HeyJB. Do you know if they retest to get a negative result? I don't know. But of course, with something this high profile, Janine, they're of course gonna stay on top of this. And by they, I mean the State Department of Health and by association, the CDC. But are they going to retest to see if that person is then negative? I don't know what the testing procedures are like. We haven't heard what follow-up procedures are like specifically after a COVID COVID-19 patient tests positive? That's a great question. So we're very curious here as well. That's maybe one of the questions that we'll ask the next time that we have an opportunity. Michael saying, #KJB, if they say it is like HIPAA doctors, they cannot give out patient information. That's totally accurate. So they, with their release, they can only say so much in their release. And that's why when I originally went live here on Facebook Live and I saw many of the commenters, I didn't know what kind of reaction to expect, but many of you were applauding and saying, that's great news, that's great news, that's great news, under the assumption that the patient is getting better. But there's nothing in the release that says that the patient is getting better. We can only hope and pray that the patient is getting better. But the news is right now only that the patient has been discharged and that they're going to be taking all the appropriate measures at Doctors Hospital of Sarasota to ensure that the place is disinfected thoroughly, cleansed thoroughly, so that COVID-19 doesn't, of course, spread. Let's see here. Liz Arnold, #KJB, how many test kits are in Florida? When will we have more than 3 labs? Another great question. I know we don't know the exact numbers because supply and demand is of course, radically increasing. We know that testing kits are in low supply. We've heard that that testing kits are something that they need more of course. I have not heard when we're going to see the expansion or a larger expansion of the lab situation here in Florida. But I'm sure we'll keep you updated on WFLA.com and the WFLA app. Jackie Tooley Coatrill, a WFLA top Facebook fan. We thank you there, Jackie. #KJB, was he even positive for coronavirus, or maybe did he have the flu? No, Jackie, so how this works is there is a specific COVID-19 test that that can be done here in the state of Florida. This person, according to the governor's office, tested positive for COVID-19. They then send off the same test and the same sample to the CDC for federal verification, and that also came back positive. So it's a double check, right? Where they check the original test through the CDC, and this person this Manatee County man who was being treated at Doctors Hospital in Sarasota, they tested positive on both. Michael asking #KJB, has the governor said if and when there will be test kits in Central Florida? It's changing so rapidly, Michael, that I just know that they are trying to dramatically increase the amount of testing that can be done here in the state of Florida. I don't want to say for sure, only because every hour it's changing with new information. I know, I can tell you this, Michael, they are rapidly trying to get more and more testing kits to meet up with demand, because this is a time of year where we have a lot of people that are getting sick and that have coronavirus or flu-like symptoms, because the symptoms are so similar that whether it be coughing or a fever, that these are similar symptoms. So there are people who might be getting sick with the flu that, because of everything going on in the news, they might be thinking that they have coronavirus, and they start to think, oh my God, who have I had contact with lately, and did that person travel internationally, and could I gotten it from here? I was in a large public gathering there. And of course, all of this, all these questions get raised in your head. So there are people who want to know for certain whether or not they have COVID-19, which of course, again, has very similar symptoms to the flu. And they're trying to meet up with demand for testing kits. WFLA top Facebook fan April Peebles, #KJB, why are they still allowing cruises? It's proven they are breeding grounds. Not all cruises. There have been many cruises that have been sailing and having no problems. Cruises have been, of course, when you have a lot of people confined to a strict space and they're traveling abroad internationally and stopping in different places. Yes, that we've heard, of course, different situations with cruises that are that have been problematic, but not all cruises. And I would imagine that the CDC and our government they are, of course, evaluating all the variables and handling this the correct way. I think that's it for the comments that I'm seeing here with the hashtag HeyJB, everybody. So that means we're going to end our live Q&A portion. We're going to go over this one more time. Manatee County resident in his 70s, a original, one of the first COVID-19 patients here in Florida that was, of course, this past weekend. That was the news when we had 2. Originally, it was the count was at 2. This was one of them that tested positive. It was a presumptive positive test that later got sent off to the CDC, came back verified that it was a COVID-19 strain that this man had. Again, a man in his 60s in Manatee County that was being treated at Doctors Hospital of Sarasota. That hospital has now discharged that patient. Where we go from here and what happens to that patient and what kind of attention is paid to that patient, the isolation procedures, what happens to ensure that COVID-19 doesn't spread here in the Tampa Bay area, that still, of course, remains to be seen and remains, I'm sure that probably by the time, right as I wrap up here on WFLA Now, the way that the world works, we're going to hear an update of some kind from maybe the State Department of Health or the CDC about those questions. But as of right now, all we know, and the information is on WFLA.com and the WFLA app, all we know is that that patient has been discharged from the hospital there in Sarasota. Again, a Manatee County man in his 60s, unsure how he contracted COVID-19. They were very frank in the press conference earlier this week in saying they're not entirely sure how he acquired the strain, but perhaps we'll hear more in the days to come. And that's why we're always trying to keep you guys informed with the very latest as we learn about it here in the state of Florida pertaining to coronavirus. That does it for us here on WFLA Now. I'm JB Buno. Thanks so much for being with us. More to come on WFLA.com and the WFLA app.